This medication is used to relieve symptoms caused by the common cold, flu, allergies, or other breathing illnesses such as sinusitis and bronchitis. Antihistamines help with watery and itchy eyes, nose, and throat, as well as sneezing. Decongestants help to relieve stuffy nose and ear congestion symptoms. If you are self-treating with this medication, carefully read the package instructions to ensure it is right for you. Some products with similar brand names have different active ingredients and uses, so it's important to ask your pharmacist if you have any questions. This product is not safe or effective for children under 6 years old, and some forms are not recommended for children under 12 years old. It is important to carefully follow the dosage directions to decrease the risk of serious side effects. Do not give other cough and cold medications that contain the same ingredients, and talk to your doctor or pharmacist about other ways to relieve symptoms. The medication should be taken by mouth as directed by your doctor. If you are self-treating, make sure to follow all directions on the product package. If you have any questions, ask your doctor or pharmacist. You can take this medication with food if it upsets your stomach. Make sure to drink plenty of fluids unless otherwise directed by your doctor. If you are using the liquid form of this medication, be sure to carefully measure the dose using a special measuring device/spoon. Don't use a household spoon because you may not get the correct dose. If your liquid form is a suspension, shake the bottle well before each dose. Don't crush or chew extended-release tablets or capsules. Swallow the whole or split tablet without crushing or chewing. If you are using chewable tablets, chew each tablet thoroughly before swallowing. If you are using a product made to dissolve in the mouth, tablets/strips, dry your hands before handling the medication. Place each dose on the tongue and allow it to dissolve completely, then swallow it with saliva or with water. The dosage is based on the product you are taking and your age, medical condition, and response to treatment. Do not increase your dose or take this medication more often than directed without your doctor's approval. If your doctor directs you to take this medication daily, take it regularly at the same times each day to get the most benefit from it. Remember to tell your doctor if your condition lasts for more than 1 week, if it gets worse, or if it occurs with a headache that doesn't go away, fever, or rash, as these may be symptoms of a serious medical problem and should be checked by a doctor. Some common side effects of using this medication include drowsiness, dizziness, dry mouth/nose/throat, headache, upset stomach, constipation, or trouble sleeping. If any of these effects persist or worsen, it's important to notify your doctor or pharmacist as soon as possible. If your doctor has prescribed this product for you, it means they have determined that the benefits outweigh the potential risks of side effects. Many people who use this product do not experience serious side effects. However, it's essential to inform your doctor immediately if you experience any serious side effects, such as changes in mental/mood, like confusion or hallucinations, ringing in the ears, difficulty urinating, or changes in vision, like blurred/double vision. Seek medical help right away if you experience very serious side effects like fast/irregular heartbeat or seizures. Although rare, a very serious allergic reaction to this drug can occur. If you notice symptoms such as rash, itching/swelling, especially of the face/tongue/throat, severe dizziness, or trouble breathing, seek medical help immediately. It's important to note that this is not a complete list of possible side effects. If you notice any other effects not mentioned here, be sure to contact your doctor or pharmacist. In the US and Canada, you can call your doctor for medical advice about side effects. You can also report side effects to the appropriate authority in your country. Before taking this medication, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain ingredients that can cause allergic reactions. It is also important to discuss your medical history, especially if you have breathing problems, diabetes, heart issues, or other conditions. This drug may cause dizziness or drowsiness, so it's important to avoid driving or operating machinery until you know how it affects you. It's also important to be cautious if you have diabetes, alcohol dependence, or other conditions that require you to limit certain substances in your diet. It's important to talk to your doctor before undergoing surgery. Children and older adults may be more sensitive to the side effects of this product, so it's important to use it with caution. If you are pregnant or breastfeeding, make sure to discuss the risks and benefits with your doctor before using this medication. Drug interactions have the potential to change how your medications work or increase your risk for serious side effects. It's important to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with this drug include antihistamines applied to the skin. Taking MAO inhibitors with this medication may cause a serious drug interaction. Avoid taking MAO inhibitors during treatment with this medication, and ask your doctor when to start or stop taking this medication. If you are taking other products that cause drowsiness such as opioid pain or cough relievers, alcohol, marijuana, drugs for sleep or anxiety, muscle relaxants, or other antihistamines, be sure to tell your doctor or pharmacist. Check the labels on all your medicines because they may contain ingredients that cause drowsiness. This medication may interfere with certain medical/lab tests, so make sure lab personnel and all your doctors know you use this drug. If someone has taken too much cold allergy and is experiencing severe symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call the local poison control center at 1-800-222-1222, or in Canada, contact a provincial poison control center. Symptoms of overdose may include irregular heartbeat, hallucinations, fainting, or seizures. If your doctor has prescribed this medication, it's important to follow their instructions and not share it with others. It's also important to keep all medical and lab appointments as scheduled. If you happen to miss a dose of this medication while taking it regularly, take it as soon as you remember. However, if it's close to the time of your next scheduled dose, it's best to just skip the missed dose and take the next one at the regular time. It's important not to take a double dose to make up for the missed one. When it comes to storing cold allergy medications, it's important to keep them at room temperature and away from light and moisture. Avoid storing them in the bathroom and freezing the liquid forms of the medication. And as with all medications, it's crucial to keep them out of reach of children and pets. When it comes to disposing of cold allergy medications, it's vital to not flush them down the toilet or pour them into a drain unless specifically instructed to do so. Instead, it's best to properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.